Now, I heard that there was this 90-day supply that suddenly is appearing because you're taking half the dose. On the other side, there's a phrase that's out there, right? The partial fill programs. What the heck are partial fill programs?
So partial fill, I think, is a great idea if you're allowed to do it. We can't do it for all medications, all patients. Sometimes the payer and the benefit plan will drive some of that. But from a point of care dispensing perspective, if you have a drug that you know within the first week or two is going to require a dose adjustment in most of your patients, and we see that in some of the newer oral agents for breast cancer and so forth, you know, you don't dispense 30 days of that product to the patient. We might dispense 7 to 10 days of the product because we're going to bring the patient back in 7 days. We're going to assess the toxicity. If they're fine, we may continue that for another period of time and adjust as necessary. That decreases waste and also decrease costs in the long run.
Well, I have to say it also decreases convenience because we have ways of dealing with our dose reductions, but the problem is, you know, let's say we need to dose reduce. We'll switch it to every other day, but at least we'll have the drugs that we have. Now you give 10 days of a drug, they need to be on it for 21 days. You have another delay, another treatment interruption. This is, and it could be.
It may not be with Revlimid.
No, we have some pharmacies, and it's based on insurances. The insurances determine how many drugs your patient will get, if they'll get 7 days, 14 days, or the whole month's supply. So I think that they need to leave it to the physician to deal with dose reductions and not take it upon themselves to give you half a month's supply.
Then again, flexibility, right? So
you need the flexibility.
if we were like the ones like making the prescription, then we should get the call from the pharmacy, the specialty pharmacy saying, you know, this patient may be eligible for a partial refill. Would you feel comfortable doing that, yes or no? And then we'll say, yeah, sure, because probably we'll dose escalate next week. And then they have the next one just ready for the patient. So if that's done in that frame, I'm 100% into that. But then again, I agree with you that that's not the way it's working right now.
You know what you read is that these partial fill programs decrease hospitalizations.
Who is
they
saying
decrease
that?
cost. I've got it here.
Well, there's
All right, well,
there is some
I mean,
data.
I'm just curious.
It is
I
a
mean,
patient
how are they
inconvenience.
decreasing hospitalizations? By supplying 7 pills instead of
Is it
21
decreasing
pills?
overdoses? Is that what's going on?
Yeah, no, so I can go from a theoretical standpoint. I don't.
Because I've seen it.
I've
I mean, I was being facetious. Yes, it's here, but it's here for a reason. These are
right. So in theory, the rationale for partial refills was because we require those doses for the escalated up. If we give full dose, the patient may have side effects, and we're not, and we are having the patient come in earlier to see us. Then again, I see that the system doesn't work that way because we're not doing in-house dispensing. So we have a third party trying to give us drugs when we really need them right away.
It's hard
Right.
from a
We
third
need
party
these drugs
perspective.
right away. When patients are in renal failure with newly diagnosed myeloma, every day not taking a pill or the chemotherapy can result in irreversible kidney damage. These patients need their drugs.
To be clear, I was talking about in-office dispensing on partial fill.
Right, I mean-
That's different.
Yeah, that's different.
I-
From
and I
the
meant
specialty
it
pharmacy.
Right.
From the
I don't
specialty
mean to
pharmacy
say
side,
that they're
yeah.
limiting the amount of drugs
Yeah,
for
that's
financial
different.
reasons.
Right.
I'm saying that there is a compliance reason to partial fill because it brings
Okay.
patients back.
Oh, okay.
Yes?
Fair
From my
enough.
perspective, from in-office, yes.
Yes.
Yeah, and decrease waste and
Okay.
frequency.
One
Yeah.
of the solutions is what some drug companies do is if you are having a side effect with the full dose, they'll actually give you send the drug back to the company, and they'll actually give you the lower dose without an additional copay
Really?
for
Oh,
the
that's
patient.
great.
Yeah, not a lot of companies do that, but some.
Now they're doing
some
it.
do.
So do you think that these partial fill programs with an in-office dispensary reduce cost? The cost stays the same or goes up? What happens?
From in-office dispensing, I would say that the cost goes down
Why?
because less waste.
Yeah.
Oh, it's waste. Okay, so if you got 30 days and they don't take the right number of pills and there's waste going on, whereas if they have to come back, you can count the pills up. And
There's less waste with a close monitoring program.
Yeah.
So what are best practices now? If you want to go over this and put a button on all of this, the best practices for managing in terms of managed care and providers to increase adherence with these oral oncolytics?
Well, I think the key is communication with the patient, having utilization of the resources that the specialty pharmacists are supposed to provide us as physicians. They get well compensated by manufacturers and hubs, so we should actually use 100% of those resources of like monitoring, utilization process, reimbursement, and they shouldn't be a burden to us. And that's the best way we can utilize the system as it is right now. I don't want to change the whole thing because it's not going to happen. And the big companies, the big specialty pharmacies are there to stay and buying health systems, actually. So they're just going to become even bigger by the day. But we should, as providers, have access to these people and have all this information available, and at the same time have the flexibility when we're doing the in-house dispensing to have that option from any manufacturer.